I didn't even know it existed. I thought I was just going to have a typical surgery where they slice this face open and kind of go in from outside. And when he offered this, I was like, let's do this. Approximately a year and a half ago, 2 years ago, I developed basically I thought it was a tumor on the side of my face, but basically what it was the saliva gland had kind of clogged up a little bit and started backing up and then turned into kind of an infection, and it basically just started kind of exploding on the side of my face up into the bottom of my ear. And the first round he just tried antibiotics and that didn't seem to work, so he had to have heavier antibiotics, and finally he was able to kind of get it somewhat taken care of. But then 6 months later it came right back, and then this time he was like, well, something's not right with the saliva gland there, something's causing it. And so that's when he went in and really did some exploratory situation in the office and said, I think you're going to be a good candidate for this. Let's go in there and just kind of clean the saliva canals out, and hopefully that will kind of take care of the situation. And it definitely worked. With mine, I think it was more the solution. The saliva is typically a very kind of liquidy solution, and mine was very gooky and kind of like thick, and it just was not passing through any of the canals that are up there. So he went in and just kind of did each one and just kind of cleaned it out and pulled it, and then once it came out, then we did some antibiotics in there to kind of help get any additional, and then since then it's just typical. In fact, my mouth is much more I guess moisturized. I don't have to drink water all the time, because before that it was very dry mouth. I wasn't having any saliva being produced at all in the mouth, and it was getting very tough to talk, to eat, to do anything. So, and then that's when all of a sudden I started feeling this huge things on my face. My wife was like, what's wrong with your face? And I said, well, it's obviously something wrong. You know, at first I thought tumor, always thinking the worst, but it ended up just being that saliva gland just got so gunked up that it just, you know, turned into infection. And it was getting to the point where once it got to the bottom of my ears, when I really got really concerned, because then my hearing started being affected. I was really hard to hear, and just to touch it, I couldn't even shave. It hurt so bad to do anything. So that's when I was like, I gotta go see ENT and see what's going on here. Basically kind of like a roto-rooter situation, you know, basically to go in through the mouth, through the saliva gland exit point in the mouth, versus having to do the surgery on the outside, where typically they would do that externally. He can do it now internally with, you know, the microscopic situation, and it was able to be done quicker, less. It was an in and out patient surgery. It wasn't an overnight type thing, so it was very quick. But yeah, he basically said it was very similar to like a roto-rooter. He'd go in there and kind of go in, see where the clog was, and then basically kind of clean it out and irrigate and do everything he needed to do. So.